lifestyles, and fasting was one of them. And so that's how I kind of maintained my weight loss and really just became even more passionate about it. So 30 years later, here I am, fast forward to what I'm doing. So I'd love to talk a little bit about our gut microbiome and what that means, and then kind of go into a little bit more about how it affects our mental health. But maybe everybody can kind of type into the chat room. I know this is a mental health talk, but would anybody be interested in hearing about how our gut is extremely linked to COVID and COVID severity, and why certain people are getting more sick than others? Maybe just put a thumbs up, and I can kind of wait a minute. And if there's enough interest, then, we can talk a little bit about that, and then talk a little bit more about the gut brain axis. So I have one sure. So maybe just like put in a thumbs up or a yes, or okay. So we're getting all yeses. Are you okay with that? Yeah. Okay. Okay. So I'll kind of just, like I said, I have a practice that really focuses on healing from within, meaning getting to the root cause of your medical issues instead of the endpoint, right? So my practice as a traditional internist was always seeing patients and treating them with medications. And I really didn't have enough time to ever really focus on the other side, which is the root cause, right? Nutrition, diet, lifestyle. And my patients were really yearning and craving for that information. We just, in traditional medicine, we really didn't have the time to discuss it because there's so many other factors. So that's really where I decided I wanted to focus on that. So my husband is actually a pulmonologist intensivist, which means he covers the ICU. He does critical care. So when the pandemic first hit, and I'm sorry about the background noise. I live in New York City, so you're going to hear sirens and fun stuff. The pandemic, the COVID pandemic first hit New York pretty early, like in March of 2020. We were one of the first few, places to really get inundated with a lot of COVID infections. And there was a huge shutdown. So my practice was considered non-essential. And so my practice was closed. And then my husband had the complete opposite effect because he's an ICU physician. So his schedule became, like triple what it normally is, which is already busy. And he and his colleagues were kind of just thrown onto the front lines in the ICU coverage all the time. And so at the time, COVID was new, and, they had a certain protocol that they would follow for their really sick patients. And they were kind of starting to experiment with different things at the time. But so there was like this light bulb moment. He would come home and discuss these cases with me about what kind of patients he was seeing and the population of patients he was seeing. And we all had heard on the news the typical patient that was in the ICU is, elderly or somebody with comorbid conditions like diabetes or heart disease. But then he would tell me about these patients of his that really were younger, in their 30s or 40s, and really no significant medical problems other than maybe just having a little higher than normal BMI, which is, like being a little bit overweight. And he came home and he said to me, because knowing that, part of my practice is I focus on weight loss with my patients, is he said to me, we're trying this new medication which inhibits one of the inflammatory responders released by our immune system, called interleukin-6. And I'll talk a little bit about interleukin-6. But he said, we're using the interleukin-6 inhibitors, IL-6 inhibitors, to treat patients because we're finding that they have very, very high levels of this inflammatory marker. And then he kind of point blank asked me one night, he said, do a lot of your patients in your weight loss practice have high IL-6 levels? And I said, actually, yes, they do, because and this is where I can explain a little bit about interleukin-6. So most of you have probably heard of cortisol. It's our body's stress hormone. It's released, when we're stressed, but it's also a good thing. It helps us to get energy in the morning. Like our cortisol usually surges early in the morning, and it's actually good for our body, but in very short, quick bursts, right? We want cortisol, but we don't want it all the time. Well, interleukin-6 is very similar. So interleukin-6 is one of many immune responders that our immune system releases when it sees any kind of intrusion, such as an infection like COVID. So for example, if you get the flu or if you get some kind of sickness, your body releases interleukin-6 quickly. So interleukin-6 gathers all these fighters, right? These macrophages and all these different cells, B cells, that help to attack whatever is intruding in our body, right? Whatever infection it sees. So it actually is helpful for us, even though it initiates an inflammation or an inflammatory response. What happens though is over time, certain people have high IL-6 levels all the time. So they have chronic IL-6 elevation, and that's not good. So IL-6 is like cortisol in that in good short spurts, it's great. It does its job. It's supposed to do its job, respond to whatever is there, and then, decrease. But what we find in people who have the same risk factors that are making them sick, they have chronic IL-6 levels. And these are diabetics, these are obese patients, these are even people who are like under a lot of stress, patients who develop cancer. We found that there's a common denominator in that they have high IL-6 levels all the time. And this is where we get that term, they have inflammation, right? You hear about a lot of people that have chronic inflammation. Well, it's probably related to the fact that they have a lot of IL-6 levels that are subclinically elevated. So how does that translate into COVID? So think of your body either in a very stable state without, this inflammatory or inflammation always occurring in your body, or another situation where your body's chronically inflamed. If your body's chronically inflamed, meaning there's high IL-6 levels all the time, when it gets something like COVID, it doesn't know how to react because it's already inflamed. So it almost goes into this hyper exaggerated response to try to localize whatever the infection is. But unfortunately, because it's already elevated, the response is not as robust as if it comes up all of a sudden. So you have these people with high IL-6. Well, guess what? IL-6 is the initial inflammatory responder that actually initiates something called the cytokine storm. And I hope I'm not getting too detailed, but I just want to explain it to you because it's going to make a lot of sense and it's going to be like this wow moment. So the cytokine storm is actually what makes patients who get really sick from COVID get into the hospital, and because it affects the lungs. So there's like this gut lung axis, right? And so that cytokine storm is like a rush of all these inflammatory responders and the body's responding and really trying to localize. But unfortunately, what happens is that the inflammation that your body has, it actually sometimes does harm to your cells because it's fighting off whatever infection you have, but it's also killing off a lot of your own cells. So these patients are already like just very, very robust, in inflammatory response. So we started doing a little bit of research. My husband, not as much, but because I had a little bit of time because my practice was basically closed, I started doing a little bit of research into IL-6, but mainly also, I wanted to really find out, why are children not getting sick, right? Children are like basically evading COVID, or they're getting very, very mild symptoms. And I know that the gut and the immune system are very well linked. So I started focusing on children's guts and seeing if there was a factor in their gut that was maybe protecting them. And then I have two colleagues who are scientists that specialize in molecular pathways who also helped me with this research. And so we started researching children's guts, and we found that the gut microbiome of children is very different from adults. And it's almost like it's God's way or nature's way of ensuring that their immune system is developing. So we're all born with an immune system. It's called the innate immune system, which we're all born with. But then over time, we develop our adaptive immune system. And when does that happen? Well, when we're children. So their gut microbiome and the bacteria in their gut are very different from adults. And there's a reason for that, because they're developing their adaptive immune system. Now, interestingly enough, their gut has 60 to 80% of their gut microbiome is composed of one particular gut bacteria called bifidobacterium. And bifidobacterium has been studied numerous times. It's well known that it's a very beneficial gut microbe. It's in almost every probiotic formula because there have been so many studies showing the benefits of bifidobacterium, and it's one of the main beneficial regulators of our immune system. So we started looking at their gut and seeing, it's so interesting, right? They have 60 to 80% of their gut is bifidobacterium, whereas it starts to decline, the levels start to decline as we get older. And in certain individuals, the same individuals that are getting really sick from COVID, very, very low bifidobacterium levels. So we started looking at bifidobacterium and seeing what its function is. Well, believe it or not, one of bifidobacterium's main functions is to downregulate, which immune responder do you guys think it is? IL-6. So it downregulates IL-6. So when children get exposed to COVID, their gut microbiome, because it's so high in bifidobacterium, automatically downregulates IL-6. Their body does not go into that inflammatory response that causes this severe infection. So it does that, but then it also increases an anti-inflammatory responder that the body releases. And so with that downregulation of IL-6 and this upregulation of another anti-inflammatory responder, their body isn't really it doesn't have a chance to mount this inflammation that's causing these symptoms. So we published this study. And interestingly enough, while we were doing our research, we found that there was a study that tested people who lived to be 100, Japanese and Italian centenarians. And there was a study that actually looked at the guts of those individuals. And they found that their bifidobacterium levels were actually higher than the non-centenarian elderly population. So there might be a link to that specific gut microbe that's definitely linked to longevity. And, the immune system plays a huge role. But what we do know is that bifidobacterium levels are very low in the high-risk individuals that are getting very sick, and they're very high in children. And the bacteria downregulates the pathways that I mentioned. We published our study. We tried to release it. There wasn't really much traction. This was back in May of 2020. We wanted to really kind of release it and try to get it out on the news as much as we can. But it wasn't really I guess accepted, even though, you have 4 doctors and scientists publishing it. Since our study, which I believe is the first one that came out in May 2020, since our study, there have been 10 additional studies since that time that have actually shown low bifidobacterium levels in the guts of patients who are in the ICU. There was a huge Chinese study in Hong Kong University that checked the gut of patients in the ICU, and they found very low bifidobacterium levels. There was another study in Italy where they gave probiotics that were very, very high levels of bifidobacterium to patients in the ICU. And those patients had an 8-fold decrease in respiratory system symptoms compared to other patients. And just recently, which is something I think we've finally made a little bit of progress in getting this out there, but I'm sharing this with you because all of you can share this with people that you know and love. There's a group of frontline critical care doctors here in the US called the FLCC. It's Frontline Critical Care Alliance, and they're basically critical care doctors that publish protocols. They update their protocols based on what they're seeing. And they just updated it stating as one of their first line recommendations for treatments, probiotics containing bifidobacterium, because they found a correlation between low levels in people's guts and increased COVID severity. So that's the gut and the COVID link. I'm happy to share my study with anybody who wants to read it, or other links to other studies. But you can even do a Google search now and just type in bifidobacterium and COVID-19, and at least 10 studies will pop up. Or you can type in probiotics and COVID-19, and now 10 studies will at least come up. So there's definitely. So I'm saying all of this because I want to I guess, stress on the fact that really our gut is going to be the forefront of all of medicine, I believe, in the next few years. We're starting to see so many conditions that are linked to our gut microbiome. And what does that mean? That means that it's linked to what we're feeding our gut. And, maybe in the US and Canada, we had, kind of a more severe pandemic because of the fact that our lifestyle and our diet is really so full of processed, foods, and we're no longer eating the plant-based foods that really help our bacteria to thrive in our gut. So, how do we improve our gut health? And then I'll go into the gut brain and the mental aspect. But so how do we get our good gut bacteria? Because we have good gut bacteria and we have bad gut bacteria, and our gut is it houses trillions of these microorganisms, and everything in the world has good and bad. Well, in our gut as well. So if we feed our gut bad foods, they're going to kill off the good bacteria. And they're going to start breaking down the lining of the gut and making it unhealthy. And that's a term called leaky gut. We can talk about that another time. But if we feed our gut healthy plant-based foods, that provides the fiber in the foods like fruits, vegetables, and legumes. It provides the fiber that actually feed our gut. And when our good gut bacteria are eating healthy plant-based foods, they're able to produce these really potent byproducts, which we call short chain fatty acids, that help to really protect our gut lining. So now we can talk a little bit more about, so how does our gut impact our mental health? Because it does make a huge difference, as I know you know, Dr. Attalla. So I guess, should I ask if anybody has any questions now about the gut COVID link before I talk a little bit more about the gut brain, or am I talking too fast? Sometimes people tell me I talk a little too fast.
Can I ask a quick question?
Sure.
Is there a way we can measure the bifidobacterium in our patient gut?
Yeah, actually, I use a gut analysis kit that tests for my patients. And it's very thorough. It actually will test your gut, and then it matches it to your specific DNA. And so it'll tell you, for example, you might be somebody who can eat, lentils and a brownie and not have a problem. I might not be somebody who can do that based on what my DNA is, but it'll definitely tell us the levels of different gut microbes in our gut. And actually, interestingly, you said that. I've had a few patients that were taking probiotics early on when I suggested it before the vaccines came out, and they developed COVID, and knock on wood, like all of them fared pretty well. But then a couple of them did gut tests, and their bifidobacterium levels were very high, which was good, right? Because they were taking the probiotics. So, and I just want to stress that probiotics are not the cure-all, right? I mean, we can't eat a really bad diet and then just think that by taking a probiotic every day, we're going to be fine. We really have to focus on eating plant-based, but also fermented foods, which have also live cultures, right? Foods like kombucha, kimchi, yogurt, but not, not that sugary yogurt, I'm not going to name the company, but real yogurt without any sugar, or kefir, yeah, things like that. Somebody typed in. Those are all also very healthy for our gut. And if you look at populations, I think we discussed this before, the blue zones, which are 5 areas in the world that have the highest number of centenarians, or people who live to be 100. If you look at their diet, it's a very Mediterranean style diet where they eat mostly plant-based foods, like 80%, very little animal protein in the form of, fish usually. And then they eat fermented foods, but they're also very active. So, the gut really plays a role in our overall health. So yeah, I don't really see too many questions.
Can I ask a quick question? I
Yes,
know
absolutely.
the safest source of animal protein is seafood, but how
Yeah.
much is safe? Like every day we eat seafood or twice a week? Like how much?
Yeah, that's a good question. Like the studies that have shown on people in the blue zones, they find that you don't need to eat animal protein every day. I think they eat like meat, like non-seafood meat, I think like once every couple of weeks, and then seafood like 3 or 4 times a week. So it's definitely not every day. But yeah, so
My last question: if we do you agree on taking prebiotics? Like there is lots of
prebiotic.
yeah, not
Yeah.
probiotics, the prebiotic.
Yeah, so prebiotics really means the fibers in our fruits and vegetables and beans. Like that's what the term prebiotics means. Some companies have now formulated like formulas where they put prebiotics in there. So they try to put the fiber in there. And so the way I look at it is you have your probiotics, which are your gut bacteria, right? And then they feed on your prebiotics. So I always, the way that I try to explain it is like, think of your probiotics as factory workers, and they have to produce a product, and their product is postbiotics, right? So how do they produce a product? Well, they have to eat. They have to, work. So they eat the prebiotic, which are the fibers present in plant-based foods, and they produce out of that postbiotics. So what are postbiotics? Postbiotics are these things called short chain fatty acids that have been shown to be very beneficial, and they help to really maintain the gut lining and keep our gut healthy, because, obviously we have foods that we're eating, right? And so the food that we're eating has some good nutrients, which our body absorbs, right? And then uses for ourselves. But then it has a lot of things that obviously we shouldn't be absorbing, and that goes out in the stool. But what happens over time, if your diet is very poor and you're not feeding your probiotics enough prebiotics to make postbiotics, your gut lining starts to weaken. And if your gut lining starts to weaken, those toxins that are supposed to go out in the stool, well, they actually leak into the bloodstream. And when they leak into the bloodstream, our body's extremely intelligent. Our body's the best at healing. Our immune system looks at that, whatever that is in the bloodstream, and it says, this is not normal. This is not something I should normally be seeing in the blood. Let me send some immune responders like interleukin-6 and all these other pro-inflammatory responders to try to fight off whatever I think this is. And this is how we enter into this chronic inflammatory state, which is really bad for our body. And this is, also a lot of people that develop autoimmune disease. It's kind of the same thing. In autoimmune disease, your immune system is attacking itself. It's attacking the body because it doesn't recognize that what it's seeing in the bloodstream is part of us. It's seeing it as something foreign, so it's trying to get rid of it. So, yeah, let me see. Yeah, I'm happy to share it. You can go to my website and go to the publications. Let me type in my website. And actually, I have a newsletter that I kind of I'm supposed to send it out regularly. It doesn't always come out as regular as I'd like, just because I have a million other things going on. And so if you go to my website, you can actually see the study in the press section, the publications.
Dr. Bishara, I just had a quick question about,
Yeah.
there's a lot of, I guess, debate, discussion around how many, millions of seed, like the colony forming units need to be in a probiotic for it to be effective. So I guess that's the first question. And then the second part to that is, and people have also mentioned, well, unless it's in, refrigerated versus in capsule form, like the potency is not the same. So
yeah. We could definitely talk about that. So I'm actually in the process of making my own probiotic, just because I've tried a few good ones, but I also want to make something that people can take, that's cost effective and still effective. So yes, your question is a great one. So yes, the refrigerated ones are obviously, you can probably get away with less microorganisms in them, and I can explain that a little bit. So probiotics they're counted in something called CFUs, which are colony forming units, right? And that's usually in the billions. So usually if it's refrigerated, you don't need, you still need like a good amount, but you don't need as high as if you're taking a pill form. So usually what I recommend if you're taking a pill form of a probiotic, you want to make sure that it's at least, usually like at least 25 to 30 billion CFUs, which sounds like a lot, right? But you have to remember when you're taking that, even though it's like in a capsule that resists stomach acid, because that's what you worry about when you're ingesting these pills, is the stomach acid breaks it down and then it kills off a lot of this bacteria that you actually want to get to your gut. So the higher the count in the non-refrigerator, the better off you are, because you're more likely to, like some are more likely to survive. The refrigerated ones, usually a little bit better. There's also like spore forming ones where you have the spores and then you mix it with water and then you swallow the spore forming ones, and they actually like the cultures kind of like, what's the word, like become alive, when they reach your gastrointestinal tract. So yeah, so that, I hope that explains. And you want to look at the CFU at the shelf life, because they can put it on the label as a certain number, but you want to look at the shelf life, because the shelf life, you don't know how long those probiotics have been sitting in the bottle, right? So
yeah, I just asked because I mean, there's I think a big push for a lot of companies, and as far as their marketing, like you look at Activia, and
yeah,
they're one that really promote like, oh, this is how many, we've got probiotics, but
yeah.
does that amount that they're advertising, is that significant enough to make a difference over time?
Are you talking about the Activia yogurt or? Yeah, I don't know. Like, I don't know, what do they, how much do they claim is in there? I'm not sure.
I'm not too sure. I'm going to look that up though.
I mean, foods like yogurt are really great sources of probiotics because they're actually like the live culture. You're eating it, right? The only problem is if they're laden with sugar and all these other additives, well, you're taking a probiotic, but you're killing off your gut bacteria with the sugar, like it's kind of like defeats its purpose. So if you're going to really have a yogurt, make sure it's like sugar-free, whole fat yogurt. That organic is definitely better, or like kefir is really good, has really good strains as well. So always better to get your probiotics from food versus from a supplement, but adding a supplement, in my opinion, is it's like the the cherry on top. So is there sugar-free yogurt that tastes good? There is, and what you can do is you can add fruit to it, so you're getting more fibers. The best thing that I recommend, which is something that I've been doing, is Greek yogurt's really good. In this case, like organic does make a difference, so try to find the organic if you can. So I make a smoothie every day, and so it's kind of a way for me to ensure that I'm getting my fibers, right, my prebiotic fibers, and a lot of times I'll put like kefir in there, but you can get, I usually have like always a stock of frozen fruits, like frozen organic fruit in my freezer in case I don't have fresh fruit. Obviously fresh is always better, but I'll throw in whatever I have. Like berries are great, bananas are great. Then I'll throw like spinach leaves, like organic spinach leaves, and I'll put it in, and then I'll put some kefir, and then you're getting a smoothie, you're getting your fibers, and you're getting your your bifidobacterium. So so let's I guess we can start talking about, and then if I missed any questions, we can catch them at the end. So let's start talking a little bit about how the gut affects our brain and our mental health. So we were talking so much about how food and lifestyle affects our health. So why is that? Well, we have something called the gut-brain axis. And so believe it or not, those organisms in our gut are actually communicating with our brain on a regular basis. And they're actually making some neurotransmitters for us. So not only are they communicating through the vagus nerve to our brain, they're actually making neurotransmitters such as serotonin, which all of you have heard of, as well as dopamine. So a lot of people don't realize that 90% of your serotonin, which is your mood neurotransmitter, and it helps to, put you to sleep, and it helps you with your mood. 90% of that's actually made in the gut. And I'll talk about the 4 main neurotransmitters and how they're affected by our gut. So as I mentioned, serotonin is our mood neurotransmitter. It's made by our gut bacteria. And it's made with a precursor amino acid that is called an essential amino acid. It's called tryptophan. And tryptophan is one of 9 amino acids. So amino acids are like the building blocks of proteins, right? They're the building blocks of everything that is in our body. And we have some that are non-essential, which means our body can make them, and some that are essential. Yes, serotonin is the happy hormone. Some that are essential. And what essential means is that you can't get it. You can't make it. You have to get it from a source, a food source. So tryptophan is the precursor for serotonin. So our body can't make tryptophan. So if we want to make enough serotonin for us to feel good and have that happy mood and just be uplifted and not, be prone to depression, we have to make enough serotonin. Our gut has to make enough serotonin. So where do we find foods that are rich in tryptophan? Well, foods that are rich in tryptophan are foods like bananas, for example, or pineapples, or soybeans, edamame, turkey. I don't know, a lot of people will eat turkey and they'll say, like, I went into this tryptophan coma and they're sleepy. Well, why is that? Because it's so high in tryptophan, and serotonin help us to like fall asleep. And so there, and also tryptophan is also a precursor for melatonin, which we know definitely helps induce sleep. So, you're eating all this and then you're wondering, well, what's going on? So that is, so eat a lot of turkey. I wouldn't eat a lot of turkey. It's better to eat the plant-based foods. Nuts also, walnuts have very high tryptophan. So it's definitely good to eat the plant-based more of, but yeah, turkey does have tryptophan in it. So that helps to make serotonin. But believe it or not, we as human beings are all different, right? And our personalities are all different. Well, believe it or not, we are all dominant in 1 or 2 of the 4 main neurotransmitters. And those are, as I spoke about, serotonin. There's dopamine, there's acetylcholine, and then there's GABA. There's also noradrenaline, but like none of us are really dominant in noradrenaline. Otherwise we'd be like hyper, and like those people that are just like, like you can't sustain being like hyperadrenalized all the time. It's like your heart just can't deal with it, because it causes heart racing and all of that. So the 4 main neurotransmitters are serotonin, GABA, acetylcholine, and dopamine. I'll talk a little bit about each one, but we're all dominant in 1 or 2 of them. And the next one that I want to talk about is we could talk about acetylcholine. So acetylcholine is our neurotransmitter that helps with brain speed, the speed of how fast neurons can communicate, and it's also responsible for motivation and creativity. So people who are acetylcholine dominant, for example, are people who usually get stuff done pretty quickly. Like you've seen people who are efficient and fast at what they do. Those are because they might be acetylcholine dominant. I happen to actually be acetylcholine dominant. And so I'm that kind of person that's like always rushed. And I try to get things done quickly. Sometimes it drives my family crazy, but it is what it is. My husband, for example, he's an ICU doctor, so he's very calm in crazy situations, like in the ICU when everyone's dying. And, personally, I would not work in the ICU if they paid me, $1 million every day. Like, it's not my situation. But someone who's GABA dominant, and GABA is our calming and relaxing neurotransmitter. Someone who's GABA dominant is very calm and relaxed and able to function in this crazy environment. So that's my husband. Somebody else might be serotonin dominant. Serotonin dominant people are usually very like happy-go-lucky. They're very like, I want to just be free to be me, and I want to be happy. And they're just like those like really cheerful people and always positive and peppy. And then there are people who are dopamine dominant. And dopamine is like our energy or pleasure neurotransmitter. So dopamine dominant individuals are people who it's almost like they like that rush, the thrill. And a lot of illicit drugs actually help to increase our dopamine levels when we're in love. Like that first few months of like falling in love, and that like great feeling that you have, that's because your body releases a lot of dopamine. It's almost like this addictive rush. It's like a pleasure neurotransmitter. And there's some people that are just dominant in dopamine. Their body just makes more dopamine than others. So for example, we have the dominance, right? But then what happens if we're not eating the right foods that help us to make our neurotransmitters? Well, then we start getting deficient in them, and then we have the opposite effect. So what happens if you're not making enough serotonin? Well, then you start feeling a little down, your mood is depressed, and if it's chronic, you're just not going to be able to function. You're not going to be able to fall asleep. And this is what a lot of times we see. And, there's a place always for medications. I'm a big believer in that. But I really want to change how we view like mental health conditions in two ways. Yes, there's treatment with medications, but how about we also try to see if there's preventive factors, like, are you deficient in serotonin, and we can, recommend certain foods or precursors to help bring up your serotonin levels naturally. So that's one. Like dopamine, actually, a lot of it is also made in the gut. Part of it's made in the gut, part of it's made in the brain. Am I getting too detailed, or are you guys okay? You can just put yeah, okay. So dopamine, for example, the precursor for dopamine is phenylalanine. A lot of you have heard of phenylalanine. That's another essential amino acid that we cannot make in our body. So if we're not eating enough foods with phenylalanine, well, guess what? What's going to happen? We're not going to make enough dopamine, and we're just not going to be, we're going to be down and just feeling like low energy and not having the motivation to focus and all of that. So then we have to look into what foods have high phenylalanine in them. Again, pineapples are great. They have high phenylalanine. Foods like, again, like I would say like walnuts are superfoods because they're high in like all these essential amino acids and all these great precursors. Walnuts and like pineapples and bananas, those are the three I would say, and edamame, those four, literally they help with everything. So phenylalanine helps to actually make tyrosine, which then helps to make dopamine. So then we have like acetylcholine, which I spoke about. So the choline molecule of acetylcholine, that choline part of the molecule is actually, it's like a lipid. It's a fatty layer. So what kind of foods do you think you will crave if you're deficient in acetylcholine? Take a guess. Let's take a guess. If and I tell this to my weight loss patients all the time, your body's not craving foods, it's craving nutrients. A lot of times if it's deficient, it really just wants to replenish and it doesn't know how. So it craves these like, certain foods. So acetylcholine, if you're deficient in it and it's made out of fat, you're going to start craving fatty foods. So what happens is our body wants to replenish these levels quickly. So we start eating these really bad fatty foods, right? But if we're focusing on eating foods that are healthy fats, that's better for us. So for example, foods like avocados that are really rich in like good omega-3 fatty acids are very good in helping us build our choline levels. Or foods like wild salmon, those are also healthy fats. So walnuts, again, help with that. So that's definitely ways that we can increase our neurotransmitters through food. GABA, we can talk a little bit about that, but so GABAs are like I said, it's like our calming neurotransmitter, but it's also our neurotransmitter that helps to keep us in deep sleep. So if we're waking up in the middle of the night, if you're somebody who wakes up at like 3 or 4 a.m., think about possibly having a GABA deficiency, because serotonin and melatonin help us to fall asleep, but GABA helps us to maintain those deep waves of sleep. They're called delta waves. And if we're deficient in GABA, what happens is we start to wake up in the middle of the night. So yes, GABA is more inhibiting. So who's somebody here is like, they know what they're talking about. They're typing in like it's almost like a summary. Yes, GABA is our inhibitory neurotransmitter. So it's like our calming it, like it helps us to relax. So
we have 3 doctors with us.
Okay, yeah.
Dr. Anya is the one who simplified these.
Yeah. So, so yeah, I'm trying to think if there's anything I missed or anybody have questions about our gut brain. I'm actually in the process of, because I do this gut brain analysis, like I do the analysis with my patients that I see, where I check to see what their dominance is, and then I check to see if they're deficiencies. But I found that a lot of times people, like they just want something that's more accessible and not necessarily like a more thorough exam. So I'm actually in the process of making like a master class where I talk a little bit about this, but then you can fill out a questionnaire of certain questions to see what your dominance and what you're deficient in. And then we have like a call where we discuss all of it, and you get information on your particular needs, right? Because we're all unique. So if anybody's interested in that, you can go to my website and sign up for my newsletter. So I'm hoping to have that ready this month. Yeah, how to raise GABA by food. Yeah, so GABA's precursor is glutamate. So you want to increase glutamate is a metabolic precursor. So you want to increase foods that are rich in glutamate. Again, walnuts, foods like pumpkin seeds, eggs. Bananas are really good because they're also they're high in tryptophan, but they're also high in magnesium. So they help us to sleep, and magnesium is really good, a good mineral also that helps us to sleep. So let's see, grape juice. Yeah. I mean, you want like the fresh grape juice, not the juicy kind, not the sugary kind. Mushrooms are really high in GABA. Yeah. GABA can shiitake mushrooms especially. So yeah.
Dr. Bishara, sorry, I help facilitate the conversation usually. I was just gonna say, Gord has a question for you. So
Sure.
he's attending by phone, so I'll just get him to ask his question.
Sure.
Hello, my name's Gord, and I was wondering, for those who are low in gabapentin, or low in GABA, is gabapentin a good fortification or a supplement?
GABA, you can take GABA as a supplement to help increase your levels. You can also take like valerian root, which also helps with, because a lot of times people who are deficient in GABA are like going to have problems with sleep. So valerian root is another good one. GABA itself is also another good one.
Thank you.
You're welcome. Would you recommend using multivitamins or supplemental proteins to improve the intake of precursors? Yeah, I mean, when I see my patients in practice, like when I do the wellness evaluations, we kind of talk about their symptoms, and I do recommend certain multivitamins. Vitamin B6 also is another one that helps with sleep. So that might be something if you're having difficulty sleeping. I kind of shy away from having like people just kind of decide they're just going to start taking all these different vitamins, because vitamins are great, but we can also get to toxic levels by taking too many, especially like the fat soluble vitamins like vitamin A and D and E and K. Too much of them is not good for our body either. So yeah, I don't know if anyone else has questions, or did I confuse everyone? I tried to simplify it as best as I could.
Yeah, I agree with you when you said like people will crave things that they are lacking.
Yeah.
I see this happen 40 to 30% of people, but I see that lots of people have addiction, like addictive traits, and they crave like sugar, fat, things that gonna trigger dopamine.
Yeah. And actually, that's a good point that you made. Like a lot of times, like people who are deficient in dopamine, they'll crave like sugary or like chocolate, like, because they want that like rush of tyrosine that's in dark chocolate. So they'll want that. Or like people who are serotonin deficient will a lot of times crave like salty foods. Or GABA, actually, like a lot of times people will crave alcohol in GABA deficiencies. So I agree with you. You probably see it more in your practice specifically. So
Also, I was wondering, what is your take on the IV vitamin and IV nutrition?
Yeah. So it depends on how low you are. Like vitamin B, I like to give like a vitamin concoction that has vitamin B in it, like a vitamin B complex. I also like to give glutathione as well. I don't know if anybody knows glutathione, but glutathione is our body's most potent antioxidant made, and our liver makes it. But unfortunately, if we're not eating enough fruits and vegetables, we're not going to be able to make enough glutathione. And glutathione is crucial. And actually, there have been a few studies that actually show. So what have we seen with COVID? We've seen vitamin D deficiency. Now we know that gut health, deficiencies affect COVID, but also glutathione deficiencies. There's been a few studies on glutathione deficiencies and worsening of gut because it's an antioxidant. So what does that mean? Like an antioxidant is your body releases free radicals all the time. So free radicals are like the toxins released by cells when they break down. But free radicals also happen when you're eating like a really bad diet, you're drinking a lot of alcohol, or you get an infection like COVID. COVID releases free radicals because it's a breakdown of cells. And so if we have enough antioxidants to counter the free radicals, we won't have as much damage caused by these free radicals that are circulating in our body, just looking for damage. And why is that? So like antioxidants like vitamin C and glutathione, they're stable molecules, whereas free radicals are not stable. So we don't want unstable molecules circulating. And to a certain degree, we all have free radicals, but you want to minimize the number as much as you can. So when you have something like glutathione or vitamin C that isn't enough, those stable molecules will actually donate an electron to the free radical to stabilize it. So that's why everybody says like eat foods that are rich in antioxidants, and people are like, I don't understand what that means. If you boil it down to like the biochemical pathways, is because free radicals are unstable, and because they're unstable, they're more likely to cause damage to cells. So we want to stabilize them, and so that's why if we have enough antioxidants in our body, they help to donate these electrons to stabilize them. So I take a glutathione precursor every day. Also, I put it in my smoothie, and it helps to increase my levels. Glutathione's a tough one because you can't really take a supplement. So I either do an IV injection of glutathione. So I'll do like a vitamin B glutathione IV injection, or I'll take something that helps my body, my liver, make glutathione on its own. Which is the whey, it's like a whey protein precursor. It's like everything has a precursor. Everything's made with protein precursors, right? So yeah.
Great, thank you.
You're welcome.
I think Marianne had a question. I saw her raise her hand there.
Yeah, thank you. So hi, Dr. Bishara. Thank you so much for the presentation. It's really useful. I just had a question since we're speaking of neurotransmitters. My question was like for children with ADHD or even adults, can we help them by diet modification?
Absolutely. And again, I see this a lot with my ADHD patients where they're very low in dopamine. And so they're not able to focus, right? Because dopamine is our focus neurotransmitter too. So I'll check and I'll assign foods that help to increase your dopamine levels. So again, if you don't remember anything that I said in any of this and all the details, just remember plant-based. So when I tell my patients that I see in my clinic is, if you're going to look at a plate and the ratio of the plate, the circular plate, every meal that you're having, and really 90% of us do not need 3 meals a day. Unless you're underweight, I think 2 meals is fine. You can do 2 meals in a snack. So a lot of times I'll do like a smoothie as one snack and then 2 meals, a lunch and a light dinner. I rarely eat breakfast. But to your point, so if you're looking at your plate, so if you look at like a ratio, break down the plate in a pie form, 70% of everything you're eating should be a plant-based item. So a vegetable or like beans, and then you can add, a little bit of carbohydrates and a little bit of animal protein. But fermented foods are really good too, and not just for ADHD, but also for people on autism spectrum. diet does make a difference for them. So, yeah.
Awesome. Thank you.
Also, yeah, another thing for ADHD that I found helpful is a supplement called L-theanine. I'll type it in here. Dr. Attalla, do you use L-theanine at all?
Yeah.
Yeah. So L-theanine is actually what makes green tea so great. It's also like, it's kind of like GABA. It's like a relaxing, very calming, but it also helps with focus. So a lot of times I'll give like my ADHD patients L-theanine to help them with focus. And actually I have a bottle in our pantry. My kids, whenever they have an exam, they're always like, oh, I need to take L-theanine so I can focus, like, you know, and they take it. And I mean, they must like find that it's helpful because they take it. So, but anyway, how much
So
should they?
have you witnessed in your practice that someone has actually been able to stop the medications and rely only on diet modification?
Yes, but I noticed that it depends on the age. But yes, some people can actually just rely on, if they're very good with their diet, and then, you know, like I said, I look at your neurotransmitters, see what you're deficient in, and then we supplement with specific not only precursors and food recommendations, but also certain supplements help to increase levels. And I've had people have huge improvements on them. It depends also, like if you've been on ADHD medications for a long time, it can also deplete, believe it or not, a lot of your, you know, your neurotransmitters. So it's not like an overnight thing. And maybe Dr. Attalla can kind of talk too about how he utilizes it in his practice also. I mean, I see patients more like from a gut health perspective, but then they sometimes happen to have also ADHD. So
Yeah, you know, the guidelines is a first line as a stimulant. I don't put it as a first line. I put it as a last line. Like when patient manifests with attention and concentration problem, I tell them, let's work on exercise, let's work on the diet, let's keep this the last resort. And then I use the least, you know, the smallest amount possible. I don't go by weight, like there are some the guidelines also by weight. How much is your weight? Then you need this milligram. I started like the lowest dose and see how the patient. Yeah, because I know in a 5-year or 10-year there will be less norepinephrine and noradrenaline and dopamine. The ability of your body to produce these chemicals would be less.
Right. And do you find that a lot of patients respond just to diet and natural supplements?
Yeah, severe, you know, severe ADHD symptoms, they need medication. I agree with that. But lots of patients, and also the overlap between symptoms. You know, if you ask someone with an anxiety, do you have attention problem? Yes. Do you have concentration problem? Yes. Do you have a problem with multitasking? So I see patients lots of time, they have an anxiety problem and lots of stressors in life, but they come telling me, oh, I have ADHD. I was reading about it, and can we do the questionnaire? I tell them, I'll do the questionnaire for you for ADHD. You're gonna score very high, and you're gonna ask me, and by guidelines, I can give it to you. But to be honest, as a doctor with practice, like with experience 10 years, I don't think that this is the right solution.
It's so true. I agree with you. I mean, they say anxiety is like the great masker because it like hides so many other conditions, and it can resemble ADHD. And a lot of people, like you said, can just have anxiety, but it looks just like ADHD because they're not able to focus and there's all this stuff going on. So I agree with you. I've had that a few times actually, where they say the same thing. They're like, I'm sure I have ADHD, and then they don't. It's just anxiety. Like it just masks all these other symptoms. So
if a patient struggles with an anxiety and depression, tell me few things, like what supplements they need to take and what the diet they need to focus on, like what types of food.
So you really want to increase serotonin and dopamine, right? So if you're going to do supplements, I guess the best ones would be L-theanine. There's also inositol, which, have you heard of inositol? It's so some people label it as a vitamin B8, and some people just say it's just inositol, but it actually there's like a Harvard study out there. I don't know why this stuff is not like out there where like people just have access to, but there was a Harvard study done in the 90s on people who took inositol, who had anxiety and OCD, and they found that the people who took, I mean, you have to take a large dose of inositol, but you build up, same results as people who are on anti-anxiety and antidepressant medications. So that's a really big one that I give, inositol for people with anxiety, and I can type it in here. But the problem with inositol is it's, you need like large doses. So the studies were done on like 18 grams, so like 18,000 milligrams. But what I usually do is I'll start like, Amazon has, like, it's better to take it in powder form, or like if I start the pills, I think the largest is 1,000 milligrams. So, but you can start with like 2,000 milligrams and see how the patient responds. Most of the time, like especially with kids, like younger kids, like most people don't need that large of a dose, but like you can start with 2,000 and work your way up to 4,000. L-theanine is also really good for anxiety. So I would say L-theanine and inositol are really good for anxiety. If you're trying to build up the serotonin, you can also try 5-HTP. But 5-HTP is not one that you want to take on a regular basis. It's just like a short term, you know, like a 30 to 60 day type thing.
I think Bryant has a question. Sorry, I just want to make sure that we get to some of these questions.
Sure.
Bryant, did you want to ask one?
Yeah, I can. Okay. Sorry. I can ask my question really quick. So aside from processed sugars, which you mentioned, are there any particular foods that stand out as being like really unhealthy for like your gut microbiology? Like you mentioned foods that are like bananas seem to be good for basically everything, but like is there an opposite, like a food that you would basically recommend for everyone to avoid
for the microbiome? Like a food that you want to recommend or you don't want to recommend?
Yeah, like a food that is bad. Like,
oh, the bad, yeah. Like very processed, obviously. Cereals, I hate to break the news to you, but unless it's organic cereal, it's very bad for you. And even organic probably isn't as great either. But cereals have glyphosate, which is a crop pesticide that they put on like corn crops. And glyphosate is definitely a gut disruptor. It kills off our good bacteria. Definitely I would say it's like cereals, like processed foods, like you know, like fried foods and you know, like McDonald's and all that stuff. They have so high processed stuff in there. Those are what we call gut disruptors. The other thing, I hate to say it, is I know like everybody wants to eat healthy fruits and vegetables, but there's something called the dirty dozen, which is the fruits and vegetables that you really should be eating organic because they're so contaminated with pesticides that you think you're doing good for your body, but you're really killing off your gut bacteria. So you can Google the dirty dozen, and every year this organization called EWG releases its annual dirty dozen list. Strawberries are always on the list. Never eat strawberries unless they're organic because they're always on the list. And you don't have to get everything organically. You don't actually have to get bananas organic. Anything like with a thicker shell on it, you probably don't need to get organic. There's like there's the dirty dozen, but there's the clean 15. So the clean 15 are the fruits and vegetables you don't have to get organic. So I mean, I know organic is more expensive. Another really bad gut disruptor is alcohol. Because if you're thinking about alcohol, when you put alcohol on your hands, right? Like hand sanitizer is all alcohol. What do? You kill off what? The bacteria on your hands, right? Well, if you're drinking a lot of alcohol, you're actually killing all your good bacteria in your gut too. So another really bad thing for your gut. So yeah, those. Yeah, not your cereals. That sounds like my kids. I think you guys need to have a conversation. My kids, whenever I go to, we have a Trader Joe's. I don't know if you guys have Trader Joe's there. They're always like, get me cereal. And I'm like, unless it's organic, I'm not getting it. So they kind of know now. So they'll always eat the organic.
I just had a quick question because you sounded like in the beginning of your talk, you were talking about intermittent fasting, which I'm a huge proponent of. I don't know if you still continue to do that. And I guess how do you kind of marry that with a probiotic, or is that does one affect the other?
Yeah, I mean, if you guys want to do another talk on intermittent fasting, that's a whole nother, intermittent fasting, if you think about it, you're fasting, right? So you're giving your gut a rest too. And your gut goes through a lot of process, a lot of cells are going through a lot of functions. And if you're constantly inundating your gut with food, it's not getting that time to rest and process stuff. So, and if you think about our ancestors and, the way people ate in the past, they didn't eat all the time. They ate barely 2 meals even. And so definitely I usually eat within an 8-hour period. And I've just gotten used to that. And people used to think I had an eating disorder in the past because I would just like not eat a late dinner, and they used to make fun of me, but whatever, I have the last laugh. But so yeah, it's great. I think it's great in terms of probiotics. You want to take probiotics on an empty stomach, just because if you think about, like, you don't want them, mixing in your stomach and your acid, like, because when you're eating food, your stomach acid increases. So you want to take probiotics on an empty stomach so that they make a quick entry into your gut as fast as possible. So I hope that answered your question.
Yeah, I did for sure. I think Kieran actually said it best. He's like, this is a lot of information to take in, but from what I've gathered from what you've said so far is plant-based is really important. The 2 meals a day that include probiotics of some kind. Obviously, like, eating organic is important, which Dr. Attalla talks about often. Anything else that you would say, like, if you take anything away from today's talk, like, do make this change in your life?
Yeah. Did you say fasting?
I didn't, but I would encourage people to do that too. I mean, in a healthy way, because I think people kind of get a little crazy with that. It's good to kind of look into it when they first start.
I don't recommend prolonged water fast. I know some people do like 4 or 5 days of water fast. Like, I don't recommend that because you're losing muscle. So yeah, you're going to lose weight, but you're also losing muscle mass. So I think doing like a 24-hour fast, like once a month, is great. I think that kind of helps to renew all your cells. And there's this process called autophagy, which is basically like your cells kind of, it's like putting your phone in low battery mode when it's almost dying. If you're fasting, your cells that are not necessary anymore are getting killed off. So a lot of times, like, these dysfunctional cells are getting killed off when you fast, because your body's preserving, right? It's trying to, it's putting itself in low battery mode and trying to preserve its functions as best as possible.
Right.
The other thing that I would add is, these are all studies that have been done on people who like live to be 100. And the other factor is walking, at least. They say like 7,000 steps, which it comes out to about 2.5 to 3 miles a day. Here in New York, it's easy to do that because we walk everywhere, but I know in certain areas, especially up in Canada, it's hard to do. But if you can do like a 20-minute walk at least every day, it's a great way to start. So
that's a great plug for our we have a Sunday walking group.
Awesome. Yeah.
And actually we're meeting this week in Bowness Park, so watch for the email. I just wanted to get to Hazen. Had his hand raised there. Do you still have your question, Hazen? You want to?
By the way, walking actually helps to change your gut microbiome too. It actually, they've done studies on it, actually improves your microbiome.
Oh, wow. Okay. Go ahead, Hazen.
Hi, I wanted to ask if you had any sort of beginner research sort of resources of maybe how to set up like a meal plan or diet that kind of hits all the marks that you need to on like a decent budget. Because I know like, as somebody who has just transitioned into kind of adulthood and like is working, it was extremely stressful for me, like my first couple months, to even imagine having to actually plan out what I'm going to eat, especially when I have parents who are even pickier than me. So being able to actually get like a decent diet at a decent price point has been a very difficult ask for me, to the point where I just kind of started doing like a meal planning service. And they don't always, they're pretty good, but they don't really always have the best stuff available all the time.
Yeah, it's tough because eating healthy does take extra time. I mean, what I do is when I go grocery shopping, I really try to just focus on getting as much of the plant-based foods as possible. And then what I do is I try to cook ahead of time, because like you said, like half the battle is preparing the meals, right? So a lot of times on the weekends, I'll just kind of make food for like 3-4 days. And what they've studied, like people who stick to their diets or like healthy meals, it's because they plan it out. And then they associate their healthy meals with like a habit that they're already doing. So for example, like in the morning, if you're tempted to, grab a donut or something like that, if you actually like make a mental effort to say like, I'll have, an apple after I brush my teeth. Like you brush your teeth, it's like automatic, right? So then if you kind of make a mental note where you're going to say like, I'm going to have an apple every morning when I brush my teeth, then you get into this habit of building like healthy food options. But yeah, it is hard. Like there's no really like miracle answer to that, other than just, if you don't buy the junk, you won't eat it. So when you go to the grocery store, just buy the healthy options and then plan ahead and make food ahead of time.
I've got a question from Dr. On, and then Marianne can go after that.
Thank you so much for your talk, Dr. Bishara. It was very enjoyable. And I actually posed a question earlier about L-theanine with the ADHD. And I think I wrote in the chat that I only am aware about ketogenic diet for kids with the seizure disorder, but I haven't heard about any diet or supplements that have been used for ADHD. I'm just wondering, since there are some clinical benefits, what will be the recommended doses for pediatric versus adults?
For what? For supplements or?
L-theanine for the ADHD.
Yeah, I mean, I don't see a lot of pediatric patients, but I know 200 milligrams of L-theanine is usually fine. You can start at 100 and see. There haven't been a lot of studies. Like 400, they say like might be too much. So I would probably do like 1 or 200 for kids and see how they respond. Yeah.
What about adults?
I would say 200 to 400. Again, don't start at the 400. You can start at 200 and see. Actually, L-theanine is good for appetite suppressant too. They found that people who are like trying to lose weight and they take L-theanine supplements actually helps with suppressing their appetite. They don't know why, but
wouldn't that be a little bit worrisome, because ADHD medications are already appetite suppressing, right?
Yeah, and they've actually that's like a warning that they say, like, keep an eye on, whether or not they
caution, but I'll definitely be able to recommend this for people who are trying to use it.
Yeah, and L-theanine is more for like anxiety. I would say like more for people who have anxiety, and like inositol is another one more for anxiety than ADHD.
Thank you.
I mean, it's still good, sure.
Marianne, did you want to go? There you go.
Yes. So hi, Dr. Bishara, it's me again.
Hi again.
So I'm just gonna kind of echo Dr. Nader's question in the chat. I'm originally from the Middle East, and I've lived my entire childhood there, where we actually used to snack on fruits and vegetables. This is what we have.
Yeah.
Not that fancy candy or lots of cookies around the filling up the pantry. How can we help our children here by having like tasty, healthy food at the same time, especially when it's very intimidating when we take them out while shopping and they see all these cookies and candy and unhealthy food, and of course they want to us to buy it.
Yeah, I mean, I have 3 kids too, so I'm not saying like I'm perfect, and like obviously my kids eat like some junk too, but what I've noticed is if you put it out there, they'll eat it. So I go out of my way to just have like a variety of different fruits, and I'll literally just put it out. Like when they come home from school, instead of them grabbing, I'll have like blueberries or blackberries or raspberries. And I'll actually just have like a variety, and like celery sticks with hummus, for example. And I'll literally just put it out on the table. And it's like what, like out of sight, out of mind, but also like when they see it, they eat it. So that's one way that is a good way. But then also you can kind of, I hate to say the word sneak in, but like cauliflower is like one of those vegetables that's very like it's not offensive. So a lot of times I'll offer them like cauliflower. I'll make, I'll mix it in with other things. But like what I've noticed with kids is like out of sight, out of mind. If it's not in front of them, they're not going to eat it. They're going to go for the junk. And I'm not saying like completely ban all the junk. But if you have like good healthy options also in front of them for them to see all the time, they'll eat it. So and they'll probably like go for it before they eat the junk. So it's definitely a work in progress though.
One more question, actually, interesting thing. I was just thinking about it. What, like taking L-theanine, and if someone comes off of it, are they gonna go through withdrawal symptoms at all?
I haven't seen that. It's a good question. I don't know the answer definitively, but I don't think so.
Okay. All right.
Yeah, don't quote me on that. Yeah.
Dr. Bishara, we learned. Oh, sorry.
No, go ahead. I was just going to ask if there's more questions. So
we learned in medical school don't recommend or suggest to St. John wort for depression because dosage could be different from one capsule to another. Do you think? And I understand it works the same as SSRIs, like serotonin uptake.
Yeah.
You suggest taking these plant over the medication or stay with the medication?
Personally, I think plant-based is always better. Your body is an amazing survival machine. It really knows what's best for it. So if you feed it properly, it'll do what it needs to do. Obviously there are certain people that will need medications, but I personally prefer to help you heal from within. So
CBD oil, how do you think about CBD oil as anti-inflammatory?
I don't know too much about CBD oil for me to like make a comment, yay or nay. I don't use it. I know a lot of doctors have great results with it. Do you use it?
Yeah, I was prescribing a lot of it. Like here, marijuana is legal recreationally.
It's legalized here too.
But I used to have like more than 1,000 patients on cannabis prescription when people like in Canada, like 2 or 3 years ago, you needed a prescription to be able to use it. But now anyone wanna go to the store and get it, whatever you wanna THC or CBD. But I was a big fan of CBD. I know that it has anti-anxiety properties and anti-inflammatory properties too, and I think and a little bit of pain killing effect, like a painkiller.
Yeah. I mean, the thing I don't use it as often because I don't know what the like long-term use is. I know like short-term use of cannabis is great, but I just don't know, like there've been some speculation about like long-term use kind of is not good. So I don't know. I don't know enough about CBD to actually use it, to be honest. So but I'm open to other opinions too. So yeah, that's why I kind of don't use cannabis as much, is because long-term effects. Have you heard of any studies of like detrimental long-term complications?
The problem with THC, like THC, is it is addictive, it triggers psychosis, has multiple like and withdrawal symptoms and hyperemesis. Like there is multiple side effects, and I see it in my practice. But for CBD, to be honest, I didn't see major, side effect. Maybe sedation a little bit, so you can't drive. But other than that, I feel it is it's good, especially like autoimmune disease. Like lots of people come to see me, ulcerative colitis and Crohn's and systemic lupus. They want to give it a try. And they already are taking the biological treatment for autoimmune problems, but we add CBD on it. So you can't tell if this is the result you're getting from where. Okay. Can I ask you one more question about your assessment? You mentioned you do work around these. Is your work, I know this is related to what you do, but is it covered by insurance, like private insurance, like what you do?
Yes and no. So like there's insurance companies here that are called so I don't take insurance because insurance companies reimbursement is literally so low, like it's like $30. And I spend like a lot of times like an hour and a half with my patients because I really want to get to know them and do an evaluation. And then I actually end up spending like an extra half hour just to put everything together. So for me, like 2 hours worth of work is not like worth $30. I think it's an insult, but so I don't take insurance, but a lot of patients have like out of network coverage where I can like give them, like paperwork to submit and then they get reimbursed. But, like I get a lot of like skepticism and like patients like don't want to, like, they always feel like, oh, well, if it's not covered by my insurance, I don't want to like do the exam. And I always tell them like, I get it. I was on that other end where I was doing internal medicine. I can tell you for sure, like this one exam, might impact you one time, might impact you like a lot more than, the 10 years that you've been seeing your internist, because you're not addressing any of these root cause issues. And I think that's where medicine really needs to change, is that insurances need to start recognizing that preventive medicine and health is more important than treatment. And so, I think a lot of us have this, unfortunately, this like mentality of like, if it's not covered by my insurance, then I don't want to do it. But I also tell patients like, you'll pay like whatever amount of money for brand new sneakers or like, all these things, but your health is more important than any of this. And your health is worth investing in. So that's my opinion, but people will pay like like $200 for like personal trainers every week to help them like exercise, but anything that has to do with like medical, like it's just like this mentality where they're like, oh no, if my insurance doesn't cover it, I don't want to do it. And that's fine. Yeah.
Can they claim it like under health spending account, like lots of
it definitely can be under a health spending account. It can be paid for. And actually mental health services can also. You guys have that too? At HSA? You have that in Canada? An HSA account? The health spending account.
Yeah, private insurance can provide.
Okay. Yeah. Yeah.
I actually have a question related to that.
Sure.
What this is actually is mostly for the physicians that aren't Dr. Bishara. Would treatment or like exams like this be covered under like the public healthcare in Canada or / Alberta, or are these like those like extra non-insured kind of treatments or procedures that we have to pay for out of pocket or through like Blue Cross or something like that? Or would you know off the top of your head?
Because the question for me, I think there is doctors here in Calgary, they call themselves functional doctor. They do, it's not as thorough as Dr. Bishara is doing now, but they focus on hormones and supplement, not mainly the dietary changes. But they are not covered, unless you have health spending account or something like very high private insurance, but it's not covered by.
Yeah.
For me, I had to study a lot. Like, I don't know as much as Dr. Bishara know, but I had to study a lot.
Yeah.
Yeah, I had to study a lot to know which diet is good, what you need to eat, what you need to avoid. So because I know I refer people to naturopaths, and the naturopath is not covered, functional doctor is not covered, so, and lots of patients cannot afford it. So I had to learn a little, like some of this stuff.
You know, it's interesting, as insurance companies here in the US, they'll pay for bariatric surgery, but they won't pay for like a wellness consultation. And you know how much a bariatric surgery costs for the insurance to cover it? It's, you know, thousands of dollars, but they won't pay for like a, you know, wellness exam for a few hundred. Reason being is they know that diet changes is work, right? It takes effort. But bariatric surgery is a one-time thing. You're going to get the surgery and then that's it. And so to them, it's more cost effective to cover that much more expensive surgery than it is to cover you teaching and educating someone to actually learn how to eat healthier. And that's a sad truth, I think, about our, you know, healthcare system, is the priorities are just not there. And you know, we're I mean, I don't know how bad it is in Canada, but we're estimated to have 50% of our population considered obese within the next 5 years. Currently 40% of our population is obese, and it's just going up, and in children it's going up. And that's the, you know, that's the sad thing, is that this is something that is so modifiable with proper diet, but you know, they make money on selling junk food and processed stuff to our kids, and you know, unfortunately. So that whole thing needs to be changed.
I've got one last question from Dr. An, and then I think we'll probably wrap up.
Okay.
Yay. So, Dr. Bishara, what are your thoughts about prebiotics? So prebiotics are now the new trend in the health world. Basically what they are is they're food for the probiotics, or the bacteria that are containing probiotics. So what are your thoughts on this?
I personally believe the best prebiotic is the actual food, the fibers that you're eating in plant-based foods, right? Those are the indigestible prebiotic fibers. Whether or not it's going to hurt, if it's, you know, like now I just had a company tell me that they want to send me prebiotic, probiotic, and a postbiotic formula all in one. And I said, okay, I'll try it. I don't think it can hurt, but really you want the natural plant-based fibers as your prebiotics. Those are the best source of food for your gut bacteria. So.
Thank you.
You're welcome.
Awesome conversation. I actually want you to come back and do an intermittent fasting seminar. I think that would be super interesting to listen to. Thank you everybody for your great questions. Again, Dr. Bishara's website is in the chat. So it's www.fromwithinmedical.com. So again, check that out if you want to be included on her mail out, on her newsletter. And yeah, very excited to see, I guess, the progress of your probiotic once it hopefully hits markets. Do you know where you're going to be selling it? Will it be a Trader Joe's? Where will it be?
Oh, I don't know. Trader Joe's is very high aspirations. I mean, well, definitely. I have an Instagram too. Let me type that in. If you guys are interested in like health and wellness stuff, I have an Instagram where I post a lot of good stuff. And also on Clubhouse, which is where I met Dr. Attalla. We can definitely do a room on, you know, intermittent fasting if there's enough interest. So my probiotic actually, believe it or not, so I'm Egyptian, and I have a lot of friends and colleagues in Egypt. And when the pandemic first hit, I started just recommending for everybody to take probiotics, and I couldn't believe they don't have probiotics in Egypt. So I am working with a colleague who works for a pharmaceutical company there in the hopes that I can maybe deliver probiotics there first, but also I definitely want to make it here too. So I'm kind of deciding whether or not I work with a company here or make my own for here, but I'm definitely going to make one for overseas. So, and it's definitely going to contain bifidobacterium. So.
Thank you so much once again for such a wonderful presentation. It was really good and
You're welcome.
really informative. Thank you.
Listening, absolutely.
Wonderful. We've got another.
Once I get them out, Dr. Attalla, it's your job to get them everywhere.
Will do. Yes, for sure. But send us few samples. Okay?
Absolutely, definitely, I will. Absolutely.
Wonderful. Well, you've got a new follower on Instagram. I just added you there. So yeah, I'm excited to see your posts and wonderful. Thank you everyone for attending. And yeah, thank you again, Dr. Bishara, for taking time out of your schedule, especially from New York. What's the time change there?
We're the same. Are you, wait, what time are you guys? What
6:56 p.m.
Oh, okay. So no, we're not the same. So we're almost 9.
Oh,
so
okay.
Yeah.
All right. Okay, well, thanks again and hope to see you in the future.
Okay, absolutely.
Thanks, everybody. Bye. Have a good night.
Thanks.
Thank you, Dr. Bishara. Have a wonderful night, everyone.
Okay.